But you gotta remember the first one's not.
We don't remember that.
Oh, really?
It's
46.
Pretty good shape. 46.
Did you have any?
Yeah. Down at Lakeview with the gateway there, you had no issue with them cutting those trees?
No.
Okay. I was down there today, they were asking me, they're not in that great shape anyway.
Yeah, and I figure it's a benefit to the county to
Right.
capture those dollars.
And I said, well, maybe you'll have to put a stone fence in there next year until we get some good shrubs over there.
But yeah, I figure, again, some dollars coming in.
We claimed you can get 100,000. And those trees aren't worth.
Yeah.
They're pretty rough shape.
That's what I heard. Yeah, all good.
Jody, you ready?
Yep, we're ready.
All right, let's call the meeting of the Department of Health and Human Services Board to order. 5 o'clock. Due to the COVID-19 meetings conducted under Waupaca County Resolution Number 8, 2020-2021, and Governor Evers' Emergency Order Number 1. Please note the following information. This meeting will be broadcast for remote access on a live stream on YouTube, and then the address there. This meeting may inadvertently cause a quorum of other county committees or the county board of supervisors. No business decisions of any other committees or the board of supervisors will be conducted at this meeting. Participation in person is permitted. The meeting will be conducted using CDC and DHS guidance regarding social distancing. Tables and chairs will be arranged accordingly. Face covering are required unless an exception applies. And I see the roll sheet has gone around. Everyone's on there except for Dr. Getters, who isn't here yet. And this meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statute, so that the citizenry may be aware of the time, place, and agenda of this meeting. And we have the agenda, the amended agenda in front of you. Is there a motion to approve the amended agenda? Moved by Sue. Is there a second for that? Moved by Mrs. Olson. Okay, those in favor signify by saying aye.
Aye.
Opposed? Then approved. Minutes of the previous meeting of January 6, 2020. They were sent out to you via email or the packet, as they call it. There, Jan?
I make a motion to accept that.
It's been moved to approve the minutes as written. Dennis, second. Any discussion of the minutes? Hearing none. Those in favor signify by saying aye.
Aye.
And the minutes of the previous meeting have been approved. Public comment. Any public comments today? Okay. Seeing and hearing none, we move on. We have a program presentation, Adult Protective Services.
I'm gonna come by the microphone. So everybody, yeah, no. Everybody run out of here then. That must be a good thing. I was not gifted with that skill. close you guys be sitting here?
No.
Are you sure? Because I can sit back a little bit.
You're fine.
Are you sure? Can everybody hear me?
Yep.
Yes, yes, okay.
Jody, can you hear her?
Jody? Yes?
Yes, I can. Thank you.
Very good. Well, I'm here today to talk with you guys a little bit about Adult Protective Services. Give you guys a review. I know you guys have had presentations from Leah in the past on Adult Protective Services. So this will probably, a lot of this will probably be a review for you guys, but I want to give you guys a brief overview of the program and let you guys know to date where that program is at as far as staffing is concerned and active cases and stuff like that. So to start with, I have a table that we're going to be looking at later in the presentation. I'm going to pass that around to you guys. So to start with, what is Adult Protective Services? Adult Protective Services serves individuals that are 18 years of age and older. They serve folks that are people with disabilities that are in danger of or are being mistreated, neglected, or they're unable to protect themselves and have no one else to assist them. So that is encompasses a lot of different things in there within what Adult Protective Services is. The protective services, the folks that are in need of them are because of degenerative brain disorders like dementia or Alzheimer's, serious and persistent mental illness, developmental disabilities, or other incapacities. So within what we know that it is and who we serve, there are principles that the social workers and the case managers that work in the program have to make sure that they follow. And sometimes these principles to other people in the public not knowing what these principles are, some situations people kind of scratch their head and go, I kind of wonder why. So a little bit of background, and these are some of the reasons why the decisions are made as they are. So the first principle that they have to follow is that adults have the right to be safe, and they also have the right for their civil and constitutional rights, unless the judge has said otherwise. Adults have the right to make their own decisions, not to conform necessarily to social norms. So people may act a little differently, but as long as they're not harming themselves or harming others, they have the right to do so. Adults are presumed to have the ability to make decisions until we're told otherwise. And the biggest thing is that adults, if they're not found incompetent, if they are their own person, they have the right to refuse services. And within those principles, that is which we work within Adult Protective Services and working with folks. The handout that I sent you guys around shows you guys the active cases, the new cases, excuse me, not active, I meant to say new cases that are being case managed by our social workers on a monthly basis. You can see that line does not stay the same as we see folks in and out. That line is never consistent. You can see that there was a huge jump in December. We see a jump in December in all of our programs, really across the board. The ADRC as well as the nutrition program and APS is no different from them. As we have family members that are coming back for the holidays, seeing their loved ones, having concerns, seeing things that weren't there before, we see reports that way, in addition to the reports that we receive from other agencies and things. So with those cases, those new cases that I'm sharing with you guys, our Adult Protective Services case managers still have their regular ongoing cases that they're working with as well. So those cases of 40, that's not one person that's taking them on. Right now it's split between two people, and two people are managing those two cases. But in addition to that, they have their other people that they're working with as well. And each month it rolls over. So what we see for adult protective services is a range. We can have light touch with someone, or we can have an extended period of time where we're working with someone. And then we have everything in between. So when you're looking at those numbers don't say the amount of time that we're working necessarily, with someone. Every case is different. Every case is unique, and we do the best to, we ensure that person's safety, and within that, doing the best that we can to find the best services that we can for that individual. So what our staff looks like right now is we have one social worker and one case manager, and we have a lead social worker that position just started on January 1st. We have hired a new social worker to take Tracy Weisner's spot, because she had been our social worker who was promoted to the lead worker. And she is on her third day of employment today. She's finished her third day. So when I say that they're being split between cases, they're being split between two people. We have 3 people on board right now, but Ashley is just getting off of her feet, on her feet. So within that, each of those folks that we're managing, like I said, we do a variety of things to help. When we're talking about elder abuse, some of the warning signs I thought that I would kind of go over with you guys on when we're talking specifically about elder abuse. What are some of those warning signs? Physical markings, physical bruisings are obviously a good indicator. Being withdrawn from normal activities suddenly, sudden changes in financial situations, bed sores or unattended medical needs, behaviors that you're noticing that someone's treating someone, belittling them, not treating them respectfully, and really talking down to that person who's being cared for. And the other thing is strained relationships, a lot of fighting back and forth, and seeing that continuously can also be a sign. Now, there is, at any one time, there may be something that comes and goes, but you know that person's getting the care that they need. Bed sores do come, but if they're getting the normal treatment and everything, that is not necessarily an adult protective services report. So people have questions all the time as we get calls coming in through the ADRC. If a situation is considered abuse or neglect of an adult, and we have right now a case manager, a social worker from the ADRC that's taking all of those calls, triaging them and determining which ones should go to those social workers. So the numbers that you see there, those aren't just the phone calls that we're getting. Those are the people that we are currently working with. I didn't grab the data for the actual calls, so I can't tell you what that exact number would be. But on average, right now, our social workers have a caseload of about 35 people. And when we get the third person, that'll put them to about 23 people. But that's in the event that we give that lead worker the same cases as the other folks. Tracy and I are working out right now that lead worker position and some of those duties and responsibilities that she's going to be handling. She's going to continue to be the lead on the interdisciplinary team that we have here in Waupaca County for adult protective services. That has outside community members that we have come to the table with us and talk about what's happening, ask questions with one another. There is an agenda that we follow. It allows a time to connect within the community, within our community partners. So she's going to continue with that. She will be the one that will be helping with that screening process. The ADRC social worker who's screening those calls right now, she's going to no longer be doing it. When our third worker is up and trained, we're going to be rearranging some things. So it's a work in progress. Tracy taking over as the lead is a work in progress as she's taken the lead on training Ashley as well right now. That was, I guess, a quick overview of the program. Do you guys have any questions, any information? Yes.
Did you mention, it probably went right over my head, financial abuse?
Financial abuse, yes. And right now, that is the most common reports that we're getting right now are financial abuse. Ebbs and flows of the different things, but right now it is definitely financial abuse. And an interesting fact, I guess, as I was reading, family members are most commonly found to be the ones who are either taking advantage of or mistreating an adult, either an adult with a disability or an elderly person. So probably no surprise to you guys, but it was me.
Any questions or comments for Melissa? Oh, Doctor?
I was just gonna, so if my mom wanted to come in and I needed some benefits to walk me through, I would call the ARDC and I would get the phone person
Mhm.
and tell them, you know, I've got an 85-year-old female and blah, 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 but I need some help or benefits to keep her in her home or keep her living independently. So then does that person make the decision, or then it goes to the social worker?
So with a specific question like that, it depends on the question that's coming in and being asked, and we get them to where they need to be different ways depending on what the question is. For that specific question, what would happen is the intake caller would answer your call and ask you some questions specific to your mom's benefits. What kind of a question do you have? What's going on now, to get a better understanding of, because the person who you're talking to initially may be able to help you, and she may not need to send you to another person. So that's the reason why she might ask some initial calls in the beginning, because she's not going to waste your time with another worker, you know, obviously if she doesn't need to.
I mean, is there a lot of forks now or roads that we can go down with this? Is it getting so big that, you know, it's hard to steer people, or is it?
No, I would say it's very manageable right now, because we have the role that the ADRC plays in working with our folks and providing them with the help and education for, we have our information and assistant social workers that are working one-on-one with people, explaining their benefits, long-term care, and what they might be eligible for. And then we have our benefits specialists, our disability benefit specialists, and also our elder benefit specialist. Those are also part of the ADRC. And the part that I like the most about the ADRC and that 6400 number is that everybody funnels through the same gate. And there isn't a bottleneck up by going through that one gate, because we have a phone rotation between multiple workers. And what people need is tracked right from the beginning, so that we know that nobody gets lost in translation, that we're able to follow that person all the way through. They're documented right away, so that we make sure that we know the person who got that call, and they have the ability to take calls for nutrition, to take calls for APS, to take calls for transportation. Those are services that aren't covered within that umbrella of the ADRC, but the way that it's set up right now, it works really well. And really, when you're calling the ADRC, you're calling with questions on nutrition, you're calling with questions on transportation. So it only makes sense that all those people are calling that same number.
Okay.
No, I was just going to ask Doctor if he sees any elder abuse cases in his office, how many?
Well, not as much abuse as people struggling to stay in their homes and trying to live independently, you know, and families wondering, you know, what they can go get, and give them the number. You know, sometimes it's just meals that they need, like you said. Sometimes they're looking for assistance of some sort at home, and I don't know if you guys can set them up for that, or if that's home care, that would be totally different.
It depends on the circumstances. It depends on where that person falls as far as eligibility is concerned. Are they eligible for long-term care? Are they financially able to provide that service for themselves and pay for that service themselves? Or we sometimes find that some people kind of fall within that donut hole where they need services, but they don't qualify for long-term care. And in those instances, then we have a small pot of money called Title 3B, and that is a service that can help with the little things that folks might need. It won't be someone coming in every day providing in-home cared for, addressing and doing those different types of things. But sometimes we find people that just need help with someone mowing their lawn or shoveling their snow. And that's enough to get them through, so. Eric and I were just actually talking earlier, that's something that a program that I don't think that we've ever talked to you guys about. Along with Title IIIB, we also have our Alzheimer's Family Caregiver Support Program and our National Family Caregiver Support Program. So we've got 3 programs that support caregivers that maybe next time, or depending on what the schedule looks like, at some point, I'd like to talk to you guys about that.
These services that you give out, like you mentioned, mowing lawn, shoveling snow, are those people charged for that then?
So again, it depends on the situation. If someone is able to pay for it, we'll connect them with the service and have them pay for it. If someone financially is not able to afford it and they don't fit any other requirements for any other care programs, long-term care like family care, we'll look at something like that. But it's a limited pot of money, so just because somebody needs it doesn't mean, unfortunately, that we're always able to accommodate that, but we do the best that we can, for sure, yeah.
Anyone else? Well, Melissa, thank you for coming, filling us in on that, and
Anytime, happy to.
I'm sure most of us had very slight knowledge of everything that is being done. And, helps fill in.
It's a complex program, but I didn't want to go down into the weeds too far, so wanted to keep at the surface, so,
Okay,
yeah, thank you.
thank you.
Should I move the microphone?
Okay, as we're moving on down the agenda, the general board business, public health COVID-19 update. Jill, are you set for that?
Yes, I'm going to start with sharing our dashboard and just give a short update on kind of where we are status-wise as far as case activity. So a lot of what we look at a lot is trends. And we started seeing, after we went through our surge, November, December, we started trending down, and we trended down rapidly. And then we kind of plateaued right around 25 new cases per day. And then we took a little bit of a bump up after the holiday break. We saw a little bit more activity, but nothing significant. And then since then, it's been pretty much flat, up and down throughout the week, somewhere between 25, 30 cases a day. I'd say now that we're getting our most recent trends, I should say, our 7 and 14 day trends have trended in the right direction. So from being plateaued around 25 cases a day, our 14 day was around, I ran it this morning, I believe it was around 23 cases a day. And now our 7 day actually is in the teens. We're around even 13 new cases a day. So that's really good to see those trends going down. Those are numbers that we really haven't seen since late August, early September. So that's really good news that we're in that state right now. Still say that with cautious optimism. We want to make sure that people continue to do everything that we've been doing. Even though vaccines are starting to roll out, we have to continue social distancing, mask wearing, hand hygiene. Those are all going to be critically important for us to stay and maybe continue to trend in that direction. And then the other factors are the reason we want to continue to do that is because of those new mutations in the virus. The UK mutant and the South African mutation and a few others that we definitely want to continue to do everything we're doing, because those can end up becoming dominant if we're not careful. So we want to make sure we're doing everything we're doing, and then we keep combining that with a vaccine rollout, and hopefully we keep going in the right direction. So just kind of a status update there. Our 14 and 7-day trends are definitely trending lately, been trending in the right direction. So that's been really positive. And hopefully, like I said, vaccines are starting to pick up a little bit now as far as, more people have gotten vaccinated. All the 1A groups, which are the healthcare workers, long-term care, unaffiliated healthcare workers, law enforcement, fire, corrections, those have all, I'd say we've reached like a critical mass where a good majority of them have at least gotten their first doses and some are starting to get their second. Healthcare and long-term care are getting their second doses. And now we've moved in this last week into 65 and older population. So we're starting to get to that population. The biggest thing there is, and I'm sure you've heard on the news too, it's a lot of it is dependent on vaccine supply. So I can tell you for us, when we put in an order, you know, we're trying to fill what we can do in our clinics. And, you know, our first week, which is 3 weeks ago, we got what we had asked for. The next week we got less than 50%. And then this last week we got about a third of what we had put in for our order. So there's much more demand than there was now because we have bigger groups that can get vaccinated. So that's a big piece of it. And the state is getting basically the same amount of vaccine that they have been getting allocated from the federal government. So hopefully that starts changing. The state start giving a bigger allocation, and everybody that's a vaccine administrator can you know, put in an order and get what they're ordering so we can continue to move through this. I'm going to share what we're doing right now. So I mentioned this is our third weeks of clinic. We had one today, and this clinic was primarily for the 65 and older group. We still have a few 1A folks that are signing up, but we vaccinated 369 people today. We moved out to a new site over at the Manual Masonic Center. That facility and that parking lot, and it's are outstanding. It's in the middle of the county, and we're very thankful for the partnership with the Masonic Center. They were excited to work with us, and it's been a great partnership working with them. And we're going to continue to hold vaccination clinics out at that site. It worked really well. Today, actually, we were planning to do like 2/3 of the appointments that we had this week today, and then another third tomorrow, like a half day. But we pivoted on that, knowing that the weather was going to play a factor, and we called everybody that was scheduled for tomorrow to come in today, and it worked out so well. It really worked well. Our team did awesome, you know, having to do a lot of calls and get everybody in, but everybody was understanding and thankful. And I don't think we had too many people that couldn't make it because of that. Everybody was kind of wondering about the weather, so we're thankful we got everybody in that we had scheduled for this week, and we don't have to worry about the weather. So I'm going to show you kind of what we have on our website as well for our clinics. So this is our main public health page, and you can, right from here, you can also request a COVID vaccine. So for those that are eligible, this is a link to sign up, but I'm going to take you first to our main vaccination page. I got the wrong page there. So we're trying to put all of the information that we have, because people have a lot of questions about all things about the vaccine, and we tried to put everything on here, and as much as possible to try to limit the amount of call volume that we're getting, is put everything on here and direct people to our website for information. We certainly still take calls, but it takes time to get through a lot of calls. But so we have all the eligible group information on here. Information about the particular vaccines. We update this weekly with how many vaccines have been distributed or have been administered in the county. That's not just us, that's all the one of the county. So last time this was updated on Friday, we do it every Friday. So I think you're going to see a pretty good increase this Friday with how many people got vaccinated this week. And then just some questions and answers. But for those that are eligible, so all the phase 1A folks, law enforcement, fire, correction, and then the individuals that are 65 or older, they can request to get on our wait list. And we have a form here. This was all developed internally. Our IT was able to do this, and basically the individuals fill out the form, and it goes to our database, and we just go off of our database for scheduling appointments. And it's fairly simple, just name, birthday, some contact information. And we'll ask, are you one of the following? And then first or second dose. And if it's a second dose, we just ask for the date that you got your first dose. So this is where we're hoping everybody can go to sign up for our clinics. We've had a few kinks here and there that we've been able to smooth out. And if someone doesn't have access to the internet, they can call our main number and then we will go on here and sign them up this way. And then they'll, instead of having an email, we'll call them to their appointment. So this has definitely been, very helpful for us to have and very helpful for us to organize and schedule appointments. It's gone really well. Like I said, 369 folks today. We basically schedule them early in the week, and every once in a while we have people who have let us know that they got a vaccine somewhere else, so we have to take them off the list and fill in that spot. But it's gone pretty well, and we're looking forward to doing it the rest of the way. So this next week we're going to schedule appointments for Wednesday at the Sonic Center for first dose appointments. People right off our list, and now we're actually in our second dose appointments because we use Pfizer, and that's after 3 weeks. That's when you can get you're eligible for your second dose. So we're going to have Wednesday is our first dose appointments, and then Thursday and Friday will be second dose clinics. And that's pretty much the schedule that we'll be going for a while, basically. Although we're hoping that it's mostly Wednesday, Thursday, and not too much Friday, because Friday can be a bit of a scramble with appointments and those type of things. So the only reason we're doing Friday this week is because we did have a first week clinic on a Friday, but definitely Wednesday, Thursday, we might dip into half days on Tuesdays as well. And then what we're planning on doing besides our just weekly clinic where people come to our clinic is when some of those next groups that were on the website that I had on the webpage are eligible, some of those groups we may go to, like, so for instance, education and childcare, we might have a smaller strike team, we'll call it, that will go to the school and be able to vaccinate all the educators when they're eligible, which right now is tentatively March 1st. That's all depends on, how much vaccine we get and how much we're able to get through the current group. I think I'll leave it there.
Jan?
I have a question, and probably Dr. can answer. Let's say I go in and get the shot, and I might be a carrier of that virus. Would I have a bigger reaction to the shot?
That's a good question, but I've had a couple of people that went in and got their shot, and then a day later were positive, and they were waiting for some results from a test previously. Why they got in for the shot, I don't understand. But so they got the shot, and they're doing fine. Whether their, immunity will be up or not, it's just like the same thing with the 90-day wait. If you've been infected, you're supposed to wait because you have some immunity from that, and they're waiting so that they can stimulate your immune system again after 90 days. But I've had a couple that have, snuck through and they still got it, and we don't know all the results yet. Are we going to be adequately immunized or not? But I don't know. I was going to ask Jed too. So if we moved it down to like 65, and I have some people now that are in their 80s, and they go on site, would they be automatically bumped to the top of the list?
I know some of the providers are doing that. We're just, I think, basically going by first come, first serve. If they're eligible, that's kind of how we're going.
Okay.
Yeah, I have a couple questions. At the end of the day, you have all the vaccine used up, or do you ever have any you don't?
Yeah.
You don't have any left over?
We have not. We do everything we possible. We are not going to waste a dose. So we're going to, at the end of the day, when we start getting towards the end, we try to schedule everybody, but I'll run someone down off the street to get them a shot if we have to. So we're not going to waste a dose.
You don't have a list for that, for people that will come in on short notice?
Well, right now what we would do is since we have like over 2,000 people on our list, we're just going to keep going off of our list. So we'll call them. So, if it comes down to the end and we're in Maryland, we might try to find manual folks really quick, but we're just gonna keep going off our list. And here's the thing with Pfizer too. Pfizer, when we get that, we're on a time schedule. We don't have an ultra cold freezer. So when we receive it, the clock starts on us. We have 5 days to use it total. And then when we start thawing it for use, then we're down to hours. And then when we reconstitute it, we're down to even shorter amount of time. We're on a schedule to be able to use that vaccine. So you hear stories too, like, I don't know if you saw in the news this last week, someone was going to a clinic and they had all their supplies and then the road was blocked and it was like in the middle of a snowstorm. And they had all their vaccine with them and if they went to use it, been wasted. They got out and started vaccinating people behind them on the road. So that's what we're gonna do if it happens.
I saw that, that's why I asked that question. And you said you had like 2,000 on the wait list right now?
Yep.
And how long do you think it'll take to get through that 2,000?
Well, it all depends, I think, if we continue to be able to if we can get the vaccine that we're ordering and can have the resources to administer, I think we'll make our way through it. And in combination with our providers vaccinating as well, some pharmacies are also being able to vaccinate. So the more people we have being able to vaccinate, I think the faster we'll go, and the more available the vaccine is, the faster we'll go. I know Data Care here, our primary provider, they're pretty much finishing up like their second doses with healthcare, and then they're also taking appointments with their clients in their clinics. And I think as time goes on, they're going to have almost every appointment is going to be for people that are eligible for the vaccine. They should have almost all their staff done the second doses, and then they'll have more appointments. So if they have more openings, we continue to get more openings. One of the pharmacies in town is taking appointments. They have a limited amount they can do per week. I believe Walmart at some point will be doing it. They have a pharmacy in the New London site, so that'll be helpful.
Ascension just called today and offered to get on the list for all their patients. So I know Ascension is
Good.
savings.
Question number one, how many vaccines did we get to start out at 100%?
So we ordered, the first week we had 360. Those are all for phase 1 folks, 360. We ended up administering, I don't know remember the exact number, but over 400, because that's the other thing with Pfizer. A lot of times you get this 6th dose, an extra dose. Maybe right now we're finding out it's about 7 or 8 out of 10 vials you get an extra dose. So then there again, you're rescheduling appointments based on all of these extra doses. You can kind of estimate how many extra doses you're going to have, but you have to kind of move and scramble because you don't always know which vials you're going to get an extra dose for. So I think we did it was over 420 the first week total. The next week we got 120 doses. And so I think we gave 140 some shots. And then this week we ended up only initially getting 100 doses, but then we were able later after we got our allocation to get some more. So we actually had 300 doses for this week. And what did I say? We did 369. So we've done probably close to 1,000 now, first doses.
And I shared this with Jen before the meeting. I'm one of those impatient ones, so I went looking for where I could get this. And God teaches me patience, because I couldn't find any place, because Jen's came later on where the public could sign up. But Theta Care sent me email on Sunday that said, you're eligible for the vaccine. And when I didn't answer it within 5 minutes, they sent another one. Well, it was Sunday at 11:07. Who puts on their checks their email at 11:07 in the morning? So anyway, about 5 o'clock that night, I went on and they gave me a choice of locations. So I picked New London because I go to there. And I could then either have it Wednesday at 2:40. That was the only one on Wednesday, or Thursday. They were all different days, all different times, 20 minutes apart. So I went in Wednesday, how exciting. And the lady that was giving me the shot, and it's really quick, its speed is like, pick out. Oh my goodness, we didn't even know what happened. Said that their computer picked out the people who were eligible to get the shot first. In other words, the computer went through your records, and if it deemed you, I call it sick enough, but it really means you have the criteria, then they call you first. So I don't know where I was on the list. And next to me, a lady from Scandinavia had gotten a shot, and she said, I fail to understand why my husband, who's over 75, can't come and get this shot too. And they explained to her that the computer picks it, and he was not eligible to come in and get it at that point in time. So I told her that we obviously are sick, and he's obviously better. At which she giggled and laughed. But it taught me that now that things are opening up, then people will gradually be able to come. But at this point, last Wednesday, Medicare was still not taking all of their patients, but having a computer pick what they're going to do and when they're going to do it. So they got to work their way down. So when it said they're opening them up to over 65, I'm thinking you haven't even hit the 75-year-old people yet. I didn't get that. So it's good that we as a county are also providing a place for people to get their shots because everybody wants one. So good job, Jack.
Have you had a lot of reports of side effects yet?
We haven't. Mostly what we hear from what we've administered anyways is sore arm and then maybe a little fatigue, maybe the day after. I have heard second doses for some folks have a little bit more of a reaction, and I've heard a little bit more from Moderna. I don't know, Dr. Getters, have you heard a little bit of that too?
That's what I've heard as well, and people have told me they've gotten it too. I mean, we've only seen the Pfizer vaccine right now, but someone's gotten it. When you make an order, do you make a request, or you just make a request for whatever you can get? Because I know you have to give the second dose of the same vaccine.
So when we make a dose for or an order for first dose, we make our order for the first dose, and then the second dose, automatically we don't have to make an order because they know 3 weeks ago that we did so many vaccines. So in 3 weeks, we're going to get that same amount of that same vaccine.
But are they sending you both vaccines?
Well, right now we only have Pfizer. Is that what you mean, or you mean
Yeah,
first and second
That's
dose?
what I meant. So if I order 1,000 doses and they don't have enough Pfizer, they send me Moderna, then I have to worry about getting that out
Oh, yeah.
to the second dose, make sure those people get that.
We would have preferred Moderna just because here at the health department, like I talked about all the things with Pfizer, it'd make it so much easier for us to have a little bit more flexibility, when we get to the end. So if they do switch us to Moderna, I think we take it, but then there's that kind of logistical stuff too. You have to plan your second doses out.
I just want to say, my facility is getting it done tomorrow for the first time, and we're doing it with Diana, and it's through Walgreens. I didn't have a choice. And what the holdup was for, the reason why Walgreens is going into all these nursing homes is because the state didn't approve, DHS did not approve the pharmacies that we work with for our medications. They didn't approve them, but they're holding up their approvals. So we had to go with a second source, and of course, I feel like we're the last building to get it, through Walgreens.
Yeah.
And I was just.
Julianne, comment on that. My mother-in-law got it Monday at her visit, and that was from CVS Pharmacy.
Oh, yeah, CVS was one of the other ones.
So, and I think the federal government has an agreement with CVS and Walgreens.
Right now, so all these pharmacies, the small little pharmacies that work out of the nursing homes, they're waiting for approval from the state. By the time they get that, we'll be all getting our vaccinations by then, So.
Okay, any other questions? Doctor, I have a question for you. I'm not sure if the science is out on this yet, but if a person was to contract COVID-19 2 months ago or something, can they contract it a second time?
good question. I mean, that's what they're tracking now to see, you know, if you had one infection and now they're starting to watch to see if you become positive again. That's why they're pushing to still do a lot of testing to see if you have been exposed again.
We've had a few cases that are investigated as reinfections, a handful. But I think they're still, like Dr. Gary says, still kind of researching that exactly if it's a second infection or still a continuation of, you know, the first infection. So, but we've had a few. It's very rare still.
Because what brings that to mind to me is that looking at your numbers, Jed, that I check every day on the computer, we've, based on population of this county, we've had over 10% that have been infected over the last 6 or 8 months. And I just wondered if they could be reinfected.
I think that's why they're saying that, you know, continue to wear a mask and protection until we can figure it out, because it doesn't get you out of the woods all the time. Or did you get enough response by being positive that, you know, your immune system got stimulated? So some people have the antibodies and other people think that they don't have the antibody. You know, they're like, last spring I had this respiratory infection. It lasted a month and I'm positive I had it. So you run an antibody test and they're negative. Now it's like, well, did they have an immune response to it or not? You know, to the virus or not? So, and then it's almost like, I guess, you know, chicken pox or something. If you have a small, you know, just a couple pox versus your whole body's covered. And then the second time somebody gets chicken pox, can you get it a second time again? You know, if it comes around because you didn't get a good enough response to it, which is why they give the stronger flu vaccine to help older people that might have a weaker immune system. But they still don't know what they're going to do. Everything is like, well, let's wait and see, and then check things out down the road again. But I still wear my mask. I don't double mask.
Okay, any other questions for either Jed or our good doctor here? Thanks, Jed, again for your report. I know we all look forward to it every month because we're all very conscious of the COVID.
One other question. So our county can vaccinate anybody in the state. If they come from Madison, that they can't get in there, they can come here.
We're prioritizing county residents. Like if they can put their name on our list, but we're prioritizing county residents.
Okay.
And then 1A folks, if you know, like the work groups, so either a resident or someone who works in the county regularly. So we some non-residents in that case.
Okay, we'll move on to under general board business, point B, which is the advisory committee reports and updates. You should have had those sent out to you. Are there any questions or comments on anything? Jan?
Yeah, I will bring up under nutrition. Melissa and myself and her, I don't know the other person that went with us. You're taking Melissa, she's gone. Oh, yeah.
But
Megan.
Anyway, we met at Iowa at the cafe over there, and to see if they would be interested in hosting and putting congregate dining there when it opens up. And so Judy, the owner, met with us, and we gave her to probably the end of the month to give us a result, how she feels if she can handle it or not. So that's a good thing for the nutrition program. And I will tell you, I'm very pleased with how Melissa and now Megan is going to be joining us in this program, because we've had so many negatives and now it's more positive. And I have to thank the girls for their willingness to bring this program together and making it a
Always good to hear positive. Okay, moving on down to finance, the income statement overview.
You don't need to answer my, can you hear me okay?
It's better if you go by the microphone because then Julie can hear you a little better. Thank you.
Oh, she took away my chair.
I'll get you.
That's okay. I'm gonna sit for 2 minutes and get up.
What's that?
I'm gonna sit for like 2 minutes and then get up probably. Okay, so the income statement that you have in front of you, I apologize that when I printed it off, I typically like to put on there that this is the preliminary report for December. So this is very far from being how 2020 is going to end as a fiscal year. Right now, if you look at the income statement, it shows that we have a loss of $145,000. There's a number of things, and I laid that out a little bit in the management report to the board. We have the majority of our December services for Medicaid. Those payments should be coming in tomorrow. So December services, our CCS services, which is a big chunk of revenue that's coming in, is a 2-month delayed process because we're collecting notes from providers. So we are waiting on 2 additional months for CCS revenues. And then we also have all of our year-end grant reporting that we have yet to recognize on our books. So I am still anticipating that 2020, when those books are closed, that we will have a positive amount. I can only speculate, and then I speculate, and then I'm like, oh wait, and then there's this, and there's going to be this. So I really hesitate to give you a number other than to say, I'm feeling confident that it's going to be a positive amount, and what that will mean then is we will be putting that money into our DHHS fund balance, which is obviously, definitely a positive for us on the heels of 2019 when we took over $800,000 out of that fund balance. Despite having, still some high hospitalization costs, savings in other areas, some of the additional grant funding for COVID should have us adding back to that fund balance. Are there any questions? Yeah.
Apparently, I did not get that copy. I don't know why.
Oh,
So if you can mail one to me tomorrow.
absolutely.
that'd be good.
Yeah.
Thank you.
Actually, I can let you have my copy.
I'll say I have an extra.
Erica, did you want to comment on the fund balance from 2019? That had been a question that had come up, and Erica had mentioned that we had consumed a little over $800,000 out of the fund balance in 2019, and I believe we had only budgeted to use about 251,000.
I think it was around 230.
Okay.
I think about 230. So if you'll recall, when we went into the budget season for 2019, so this would have been 2018, summer, fall of 2018, we were faced with some difficult decisions. There was a lot of concern about increased funding being needed, particularly related to the transportation program and the nutrition program, as well as a host of other things. It's not fair to really, single one specific area out. So the 2019 budget was approved with, again, I feel like it was around $230,000 of the fund balance. And the plan had been 2019 work towards figuring out what we're going to do to resolve this budget issue. As data was shared with you, 2019 saw far more youth than we had historically been seeing in residential facilities. I want to say it was 7 youth at one point that were in RCC settings, and those range from $10,000 to $15,000 a month per child. We additionally had a lot of inpatient hospitalizations. Again, significant. 18 had a far number of hospitalizations, but 16, 17, we had seen far less in costs associated with hospitalizations. So all that said, those out-of-home placement costs already going into the budget season, planning to use fund balance. That's how we ended up with that over $800,000 on your income statement. It lists at the bottom there how the exact dollar amount that we ended 2019. So I say 2019. When Heidi is presenting to the finance committee, that actually happened in 2020, because we wait until the books are closed. And so it's 2020 when she says, I'm taking $800,000 out of your fund balance. Again, those are all associated with costs in 2019, but we're waiting until our fiscal books have closed. So just like, the situation we're facing now, 2020 books are not closed. It will be sometime in 2021 when Heidi will once we close the books and everything's been accounted for, make that adjustment for our fund balance. Does that make sense? Absolutely.
Question.
Yeah.
So with our mental health, it's always like almost 300% over our budget. So if we had 150,000 budget and it's 500,000, do we take over from other budgets to fill in that gap, or does that all come out of the fund balance and to cover our expenses for mental health?
Sure. So first of all, there will be like this cost settlement. So yes, if there were programs within the year that had underspent, their underspending, if possible, if not grant funded, would help cover the cost associated with that overage in, say, mental health, for example. So once we've taken the whole Health and Human Services budget pot together, bottom line, then we go to the DHHS fund balance that's dedicated. In the awful event that we would exhaust that, then we would go to the full county board's reserve accounts. Knock on wood, that doesn't happen.
I was gonna say, there's
Right.
some strong questions about what happened.
Right. And to speak to the hospitalizations, yes, absolutely. We've talked about past practice had been, we want to budget to expectation. But that got us into a $800,000 dip into our fund balance. And so there have been, not only when we received additional funds from DCF, that was funneled into that specific line item. You see that adjustment on your mental health report. And, I apologize, I don't remember the number, but as part of the 2021 budget, we also funneled additional monies to those hospitalizations.
The process was to try to budget more towards realization.
Correct.
Than, certain expectations.
Compliment. Of course, when I read through all those bills, I have questions, and they aren't the big ones, they're the little ones. And so I decided, and it was entirely my fault, because I got my taxes done early, and so I can read this all through. And so then I immediately emailed Erica, because, hey, I had the time, so I tried to figure it out. And so I asked her my questions, and she emailed me back. Well, I didn't read it till today. Thoroughly on all the questions that I had. But one of them dealt with the Amazon purchases, and I think Ted said that had to do with our special needs. And I made the comment, I talked to Shauna about it, and I made the comment to Erica too. The reason I understood that was, and now you're going to get a little bit of history and Pat Craig on happiness. Back in the olden days when I was on DHHS, we were invited and could go to like the caregivers conference, the volunteer picnics, all of these things that helped me understand DHHS better. So when it said, pledge, that's just pledging,
Sure.
everybody knows how to pledge. And it was, you know, the sanitary, but I couldn't understand why you were spending $47 on pledge. I mean, but then once it was explained, these are all the rules you have to change every time there's a parent, you gotta be doing it. Okay. So then we got to the ones with special needs, such as scooters, therapy swings, weighted lap pads. Jan and I know what you were talking about because we were at a caregivers conference where they totally explained we needed their clients to have all these things. And this was maybe what, at least 5, 6 years ago? So I respectfully ask that if we have these things again, seeing as we have new members on our board, that we be allowed and paid to go to those because we learn more about what your business is about and what we do for the people of Waupaca County. And looking them up, I was thoroughly happy going on Amazon because I have Amazon Prime, and trying to find this stuff. And I learned there's all kinds of these toiletries, they're called, little things for people or adults or kids to chew on. And then I went to Flag House and I thought, whoa, I can see why we're going to Amazon because that is really an expensive company, but it probably makes very good products and feels that that's what you need to have. And so I appreciated all the information that was given to me on my questions because I felt in asking questions about the bills, I get more knowledge that helps me make good decisions towards why do we need this money and what are we doing. So thank you, Erica, for all your help and Ted for sending an email to on the Amazon purchases.
Absolutely. I think it's great. And I'm just going to speak for the department. I hope you don't mind, Ted. But I think it's helpful to get feedback from this group too about how it's best that we share information with you about what our programs, we're having our program presentations. You got to hear a client from one program, hearing about getting to participate in those types of things. So, I would encourage, please, let us know too, what's the best way, how you would like to hear about what we're doing.
One of the things that I mentioned it to Jan that, and I've not talked to the management team about this, but once COVID is done, and it's certainly not going to give you the kind of information that you would get at a conference and those things, but that we have an open house for the board upstairs to be able to meet all the new staff, have them present a little bit of their programs, just have a kind of a semi-formal, informal process that where we just build the relationship again with staff and get to know the program.
I agree. I think that's so important. I mentioned to your predecessor before, they always talk about retreats. And I had said to him, we as a board don't necessarily know, like Dennis, I know a little about Dennis, but not a lot. I'm sure Dennis knows a little about me, but not a lot. It's nice to get to know people and then for also the staff to get to know us and us to get to know the staff. I will truthfully say one of the wonderful things that happened was when we interviewed for the new director, the entire staff came in. And I thought, oh, that was good because they said, I'm Erica, and I'm in charge of the financial office. So I scrolled down, Erica, finance, and as everybody, the manager, everybody who was a manager came in, I put their name down with which department they were in charge of. So now when I see Shauna in the hallway or downstairs or coming out of the building or going in, I know who she is. I know who are. Still don't know.
No, she doesn't.
It's Lana's replacement, I know what she does. It's very, very important, but I never know whether to say administrative assistant or whatever. So I think it's really good for all of us to get to know you and you to get to know us. So I am very happy to hear that. And I also appreciate every month having a different department come and talk to us about what they do, because then if we have questions, we can ask them directly. I mean, and Erica is always available. I appreciate she always says, you have any questions? Ask me. And I feel comfortable in doing that, and you always cheerfully answer back, and I'm sure if Jan or Judy or any one of us has questions, she'll do the same, because you're trying to tell us how you operate, so thank you.
Absolutely. You know, I have shared with folks that every time you ask me a question about that, it's providing me an opportunity, at least from my scope, to share a little bit, you know, about our work.
Thank you.
And I moved offices, Jerry, so if you're looking for me.
No, but I was gonna ask you, how come it is when I come into your department and I'm walking towards your office, once the light goes out, the door shut?
I just completely moved now to avoid you. No.
Well,
Ted wanted me to be closer. I think it's really for the candy dish. He said it was
oh,
to be in communication.
Yeah, I can't wait until the time where I can abandon that. But it never seems to get empty. I don't know what that's on.
It does not, don't tell my
Where is
husband.
your office now instead of the back?
I moved into the former deputy office with the addition of the new fiscal position, since she'll be primary support to the fiscal staff, opening me up to be more of a support to the management team. So she took my office and
Good.
I moved over there.
it's a shorter trip for you for the candy dish.
It is. There was strategy there, Jerry.
There were some people who are now further away, and I said, well, it just gives reason to take two pieces because you've taken extra steps to go get the candy.
Any of you ever get a chance to get up to our office, it's a nice array of candy. It's not that El Cheapo
Yeah, but
stuff.
Lent is coming up, so you gotta paper that a little bit.
Why?
Just because. So,
I give up bungee jumping.
give up golfing.
Give up questions.
I move to approve the bills.
Oh, do you want, well,
No,
We haven't got it.
we're not there yet.
we're not there yet.
We were just talking income statement
Yeah,
Right,
and candy dish.
right. Well, I was trying to
Which
move
is
this
more
on.
important.
I do, if we're going
So
to move
two
on.
signatures there, both of those documents that we signatures on.
Jerry, are we gonna go to the payment register?
Well, once we make the motion on the floor, then you get to ask all the questions.
Okay. You made the motion.
I did.
There's a
I'll-
second. to the
I'll
motion.
second.
And moved and seconded to approve the payment register.
Right.
Now, are there any
I
questions?
do have one, Erica. And maybe you can put me on the list because my arthritic knees could use it. I want to know why we're paying for Stem Cell Science Oklahoma.
Can you tell me what page you're on?
Well, let's see, yeah, 6.
Page 6.
Yep.
Do you
And
know?
it says Stem Cells or Cell Science.
Oh, okay, so Stem Cell Science Oklahoma. I'm hoping that, sorry, Shauna, I do this to you regularly here. But this is listed as some type of sensory item that was, it looks like being purchased for one of our CLTS clients. $23.30, and it has BP.
I'm sure that it's an item that Amazon doesn't carry, so we have technical specialty stores. So I can follow back up with you again on what exactly was purchased.
Yeah, I was wondering if it really was stem cell or if it was something else, because I would sign up for it.
Going to follow back up with you again on what exactly. it
Sure.
was? Okay.
Sure. And then the other question I have, it's 22, page 22, and it might be even before that. What type of training in Green Bay were these people at?
Oh, that is a good question. One, I'm going to assume it was actually virtual. Yeah, so UW.
I didn't think that it was virtual. It was a training on how it was for leadership or management during like having your employees be remote and how to be like conscious of like what we need to track and how you can prove like that they're doing their work duties and how we manage that at a different time. Because having employees out of the office, you're not seeing it all like in person. So that's what the training was. It was an online like training through UW Green Bay. Thanks, Liv. Yep.
These are two separate ones.
You're right. You know, somewhere in the past, and some of you that have been on this committee for an extended period of time, we got to the point of where we were saying perhaps it would be good to give, in this case, it'd be Eric, a call before the meeting. Because as you can see, with 35 pages of things, it's kind of, I won't say unfair, but it's kind of amazing that anybody would know each of those things. So, and then bring it up to all of us, but at least Erica will be alerted to what the question is, and she'll be able to research it before she comes.
Yeah, and I do, my apologies that it takes a bit, this is not ready right away when the packet is done, because we're waiting for the month to end and we're waiting for those procurement card transactions. So with the timing of this meeting, it's a really short window, unfortunately, to be able to produce this report and then get that out to you. But it is true. If I know ahead of time, I'm able to provide far greater detail, to the questions, more specific. I try to do my best to provide.
I didn't get it until late Monday afternoon.
It was
And
Tuesday, I think Tuesday. You're giving me more credit than that. It was Tuesday.
I have other places to be at, so I picked it up at night. And I'm gone in the morning.
Yeah.
So Jerry, I tried to call, but I'm sorry, I heard it up.
If you tried to call,
discuss
then you
something.
did your part. You were trying to find out.
And sometimes it's a little bit fun too, like, okay, can I get this one or not? It's a little bit like a pop quiz in a good way.
Question?
Yes.
It's a good segue to what I've been thinking all the time, because there was 1 month where we couldn't, we had to approve the bills from the prior month because there wasn't enough time for us to look them over. Why exactly is my question, do we meet on a Wednesday? That's the first Wednesday of the month. That can be the first day of the year, and the first day of the month, and then expect bills and all that stuff to happen. So I don't know the history behind meeting on the first Wednesday, but I'm thinking, is there something better that would help, that would be able to accommodate everybody? It's just a question, can't act on it, but we could, whatever. And I understand that we have to meet before finance, because that is the one that takes the major thing. So I would want to have it before the second Wednesday, but I don't know why we picked the first Wednesday. I'm still going.
Well, Pat, I tell you that I've been on this committee for 18 years. No, 17 will be 18 next year. And it's always been the first Wednesday. I never thought about it one way or the other. It was kicked somewhere in the even before 17 years ago. That isn't to say we can't change it. We can change it. But you were asking the question, why is it on? And I don't know.
Yeah, I don't know.
Well, and I know during, I don't recall exactly when that occurred, but during my time here, in the last 7.5 years, we did, that kind of time crunch has changed because we were providing you with the payment registers that was from 2 months previous. And I know that, this board said why, would like to see something that was more recent. And so, while keeping the same date, but, upping the data that was being presented to the board. So It wasn't, it was a little bit less of a time crunch
Oh,
previously when,
well, especially if you're doing it 2 months.
right, I had all kinds of time then, right?
And then my attitude is, I'm sorry, but the bills have already gone to finance and they've already been approved on the second
Right.
Wednesday, so why are we even approving them at this level if they're already gone through? I mean, let's say.
Yep.
for argument's sake. But it's like, I couldn't understand that, and so I just thought, now's the perfect time to bring it up, because even though we have, and that's maybe our fault, we all have the iPads, but if you don't get a chance to look at it, and you don't get a chance to see it, and it makes it difficult. So my thought was if we could hold it later than the first Wednesday. But I don't know, so. Was my question.
Good question. Something this committee may want to look at in the future.
Did everybody get a chance to sign?
You want to?
I think if you sign them, I will take them.
Okay.
Here, I thought I was only gonna be sitting for 2 minutes.
Thank you, everybody.
You're welcome.
Okay, personnel employment updates, resignations, retirements, recruitments, and so on.
Everybody got the beginning of the year spreadsheet that Liz puts together, and you'll notice that we did have 3 resignations this month. One was anticipated due to a, I guess, a fit. The job really wasn't what they were looking for. And then the other 2, Jed, I don't know if you want to comment on the one resignation you had. But then we had one in economic support that just was ready for that.
Yeah, we had a resignation in Healthy Beginnings. One of our case managers had found a better, not better, but another opportunity, and which included some a little bit more part-time hours that they were looking for.
Do we have the ability, sometimes used to, get the resignation letters so that we can see what they actually said? I mean, I'm just gonna say there was one I thought that was extremely valuable to us, and knowing why that person was moving on. It was a very diplomatic, well-phrased letter. But if we don't see those anymore, we can't really sense what's happening.
I can make sure that those happen.
Okay.
Some of the interesting that at least a couple have been just 2-sentence emails. But I can make sure that we get that.
Sure, thank you.
Okay, the director's report and agency overview.
Everybody got the monthly report. I hope that you're finding the information helpful in the new format. I'm trying to give you a little bit better information in a useful way with a little bit of narrative, but also some data. We will, this will be the next month, we hope to possibly start more of a dashboard to show you some trending data within the different programs. I really don't have much more to add or anything to add to this other than just a little bit of explanation to the last comment in regard to some of the policies we're working on. But one of the first ones that we will be looking at is the policies and procedures around client death, or in particular, when there is a death by suicide. We are coming up with a process to provide a more more of a response to helpful, hopefully to be a little more helpful to the community to deal with such things. That we were exposed for our shortcomings in regard to a young man who died by suicide when we really didn't know what to do after the fact. Where we should reach out, who we should try to support, those types of things. We've done a much better job than the most 2 recent deaths by suicide. We were able to respond quickly to schools, to the employers, to the family, in a way to provide support and have people on site to assist. We are looking at coming up with even a more comprehensive approach to even, and we're being asked to look at and have some initial conversation at the management level in behavioral health and responding to have someone, a social worker or a therapist on site when they respond to assist with dealing with the family. So anyway, it's it was a tragic situation that caused us to really see where we had some vulnerabilities, and we are trying to address those. Other than that, I don't have anything unless anybody has any questions in regard to the report.
I just want to segue on that particular incident and the results vis-a-vis the department. And that I have been privy to discussions with Ken where he has been consciously and very thoroughly putting procedures and lack of procedures at times and things of that nature of the department operation under the microscope. And I really appreciate, and I told him that, I really appreciate that, because even if we have a procedure, maybe that procedure was put in 12 years ago or 5 years ago, and things need to be looked at every so often to see that they're still applicable to what we're trying to do and what are best practices to do. And he certainly has done yeoman's duty as to looking at those. And he's going to, that sort of thing is going to make our department stronger and more effective for our clients and our citizens. And that's what we're looking for. So,
And one of the other ones that rose to the top with the managers too is communication with partners and how to communicate. We are looking at, and then we've engaged Diane, our court counsel, in trying to find ways to where we are able to have quicker conversations. Law enforcement, schools, they're not interested in knowing the deep dark secrets of the folks that we're working with, but knowing that we're engaged, what we're doing, and trying to get all those arrows pointed in the right direction through, and in the same direction through communication. So we're looking at that as being a top priority as well.
I appreciate the explanations, because the first one, at internal and external communications, I thought the department was changing to be able to do that, because that was a major reason we all as a board had a problem. And then with the policies around the client death, is it my understanding that we do communicate with schools? Let's say they know of somebody who's having difficulties, do they communicate to us to let us know? And we'll pick on teenagers. It could be a 29-year-old, it could be a 56-year-old. Do they communicate with us that there is that problem, and do we communicate back if we know there are those tendencies, so that they know that this person is feeling that way? Or is it the silos approach where they do their thing, we do our thing, law enforcement does their thing?
Well, unfortunately, Pat, that's kind of the way things appear to have been, even internally. That's why the internal-external communication. That, we don't always talk to each other internally. So we have multiple programs involved with the family. We may have a high-level conversation, but not deep down to fully understand what's going on. So we're looking at that. As to whether or not the school, whether or not schools or law enforcement talk to us, and we talk to them, I think it's very piecemeal. It depends on the location. For example, with the first young man who died by suicide, we were not invited to a meeting by the school who didn't trust us. That was their response. We've come a long way since in our past few weeks to where we've had additional conversations and actually helped move things liaison officer, I know they have a different name nowadays, but met with those folks, and I think we're headed in some good directions. But in meeting with folks, they don't believe that we've responded and that we hold things very secret, far beyond what confidentiality requires. I think that we also have unintentionally, I'm sure, lost track of the fact that we do have, at least with the schools, we do have memorandums of understanding where we, in legally, we can talk to them, but I'm not sure that we have them. So that is an area of priority.
You as a director meet regularly with the superintendents of the schools that are in our county?
We're working towards that. With COVID, it's been a little bit challenging because sitting across the table is certainly a bit easier. We will be meeting with as a management team with not all managers, but select managers with the Waupaca schools, working to negotiate that with Waupaca. I had a conversation last Friday with the superintendent, went up to Clintonville and sat with the superintendent up there, all wanting and willing to sit down and have our folks, sit across the table so we can have conversations about specific kids. And it's interesting because they all seem to say the same thing. They don't want to overwhelm us. That's not their intent. Their intent is just take, and we all just kind of figure this out together. So it's been good conversations.
I'm appreciative of that. I guess I thought part of that was happening already, that we were, having communications with them so that they weren't afraid to call us or hesitant, I should say.
We've got a lot of years of
to us
history
to do that, but yeah, that's good. I'm glad to hear that we're working that way. Thank you.
Turning that ship around takes a while. The communication ship.
There's always a captain on the ship.
Well, we got a good captain,
So that's what I'm saying.
but the Titanic doesn't turn in a hurry.
It takes time. I understand.
Okay. Any board member reports of meetings attended in general or general correspondence? Okay, we'll move on to point 6, adjournment. Is there a motion to adjourn? 2, and Dennis? All those in favor of adjournment, signify by saying aye. And next meeting is March 3rd. And apparently, according to the weather people, look out for the end of the week and the beginning of next week. We're